anxiety. So today we're going to talk about alcohol use disorder and anxiety, and in specific, is can alcohol use disorder cause anxiety? And then another variation of this is, can anxiety cause alcohol use disorder? And then another even better question is, in COVID-19 2020, can alcohol use disorder cause anxiety? And can COVID-19 cause anxiety causing alcohol use disorder? So there's a lot of topics to cover here. Really, one of the biggest things is that I want to talk about here is this thing. So this is Batman, and Batman has alcohol use disorder. And see how he's hitting this tire. He seems a little pissed off. He's scared of green rocks. I think, and then he works out. You know, like a whole ranges of different behaviors going on here. And you know, it's, you know, what's going on here at night, you know, and what he's doing is, you know, pushing stuff, making lasers, all signs of alcohol use disorder. So thereafter, you find him as a teacher who's drinking and drunk, and then Batman, you know, and then Batman thereafter can be found here in the interview with Barbara Walters, and then, well, he's in an interview with a bunch of people. Actually, you know, I actually like that interview, because he says something really important there. That's Ben Affleck, and he says something really important. But you know, alcohol use disorder as a pre-existing condition for COVID-19. It's very interesting that in COVID-19 America today and COVID-19 world today, a lot of people surveyed in China reported increase in depression, anxiety, stress in response to COVID-19. During social isolation, alcohol use disorders increased in the Hubei province compared to other provinces in China due to the COVID-19 outbreak. So Hubei experienced about a 10-fold increase in hazardous drinking compared to other provinces with fever. And this is basically out of this Journal of Alcohol 2020, October 18th. So this is a fairly recent, very recent. So that's one thought process. And then this social isolation and loneliness have long been recognized as a predisposing factor for problem drinking. And so, can anxiety cause alcohol use disorder? Yes, if that is the go-to feel-good drug. Anxiety can also lead to depression. Anxiety can also be a comorbidity of depression. Anxiety can also lead to using cigarettes and opioids and all these other things. So yes, so mental instability can lead to physical pain. We know that for a fact. And the bottleneck is the trifecta. Either other people causing you anxiety, either the world stresses causing you anxiety, or your mind causing you anxiety. And those are the three that are out there. And the bottleneck is, of course, the mind. And if you're not able to control the mind, you're not able to do anything really very well. So learn how to control the mind, and you will. And this is a very interesting thing that Ben Affleck says after he's recovered. So I find this a very interesting interview, but I also find that Ben Affleck's looking down a lot. And he's probably focused here, right here on these socks that are there. So probably his socks are pretty distracting. So then thereafter, he talks about these things. So I think it's really important to talk to this point is that basically you take a look at what Ben Affleck is saying is that basically people try to express themselves in different ways and try to cover up the pain in different ways. And really, once you found a good way to cover it up, usually the thing that was covering it up before doesn't work anymore. And that's usually, but that is different when you have a different thought process that you go after. So talking about COVID-19, increased alcohol intake during COVID-19 outbreak, that's bad. So we had a professor, and the professor apparently was addicted to alcohol, and he was an incredible professor. I remember one of my residencies, I won't even say, what state this is from, but this is probably one of the worst situations in the world where, he had this addiction, and ultimately he succumbed to his addiction, and he ended up killing himself from his alcohol use disorder. So there's a big association with alcohol and suicide. And it is something that we are working on heavily right now. And this is, in this video, you can see, let's see right here, pull it up. Oh, that's right. This is Nusair, and he helped us out immensely by helping us launch this thing. And said, so why are we talking to suicide in an addiction video? The video is called Go Run Go Addiction, but why are we talking to suicide in an addiction video? The reason we're talking about it is because addiction and suicide are heavily correlated because of exactly what Ben Affleck just said. And it's just words of wisdom. If you can just listen to what he says, is this. Let's go back and listen to it. Wow, what a profound statement this gentleman has made. There's a universal aspect of this means it's just not working anymore. Meaning the body has no longer found a way to create pleasure out of this activity. And hence it is now a destructive behavior in its entirety, where it's just being done because the body is requiring it and the body knows that it's killing itself. And that's basically a slow suicide that takes place. So anxiety can cause addiction, and addictions can cause anxiety after that addiction in and of itself is burning one out, and they call that in spiritual life being burnt out from the material world. And then in another way to look at this is that alcohol can cause anxiety when one is withdrawing, and withdrawal from alcohol looks like seizures. It looks like hospitalization. It looks like vomiting. It looks like a very, very severe situation and can also cause death. So it is a Chakravyuh, and in Indian philosophy it's also a Chakravyuh. So what that means is that it's also you're surrounded by all sides. So you're surrounded by doing the act. You're surrounded by not doing the act. You're in this situation, it's being surrounded by all things. And really the only person that can save you from a Chakravyuh, which is a situation where you're surrounded on all sides, is the Supreme. And that is what this video ultimately comes down to. And it comes down to that thought process that basically in our research, which I did at Henry Ford Hospital during my fellowship, that those people who do get involved in a spiritual way in the spiritual manner, or step 4 of the 12 steps, and they really find a way that can really help one to gain the karmic quotient that they need to get out of this situation. And so, if there's anyone who is incredibly talented, it is this gentleman who is Ben Affleck. But then also his vice ends up being something that that can destroy him if he doesn't take control of it, and has already taken a toll. It sounds like he's well on his way to let it go. So another thought process and another paper here in Addiction in 2019, so pretty recent too, is associations of child and adolescent anxiety with later alcohol use disorders, a systematic review and meta-analysis, and a prospective cohort studies. Now, this is seriously important because one thing that I realized that neither the East nor West, well, the East is a little bit better at it, but even, the East is better at it, not because of the schooling systems that have been out there, but the East is better at it because of the ancillary activities that are going on that are more acceptable in India than in America or in the West. To be able to talk to mental health. Mental health, as far as a stigma, and in the white collar world, especially in the West, is very difficult for people to talk to, because oftentimes those people that are talking in the West to these things, as far as mental health is concerned, they have no idea themselves, number one, how to deal with these mental health issues, and number two, the go-to for yoga and these mental health issues is not as well accepted. It is more accepted than it was before, but it's not as well accepted as it previously was. But now, obviously, this is something that is coming out, it's being shared, and people that are serious about this will end up doing this. But it's very interesting. I say evidence to date is suggestive, but far from conclusive, of a positive association between and during childhood and adolescence and subsequent alcohol use disorder. It sounds like there's some suggestion that later on in life, that children with anxiety will ultimately use alcohol, or children with anxiety will ultimately have a higher use of drugs. So I will see you in my next video. Thank you for joining. I'm Dr. Beluja, and this is the KneeTie Go Run Go show.